Ever noticed a small, bright red growth on your skin and wondered what it could be? It might be a cherry angioma. These common skin growths, often referred to as red moles, are typically benign, meaning they're not harmful or cancerous. They have a distinct reddish or purplish appearance, somewhat akin to a ripe cherry, hence the name. But what exactly are they made of, you might ask? Well, cherry angiomas are composed of small blood vessels clustered together, creating these noticeable growths. Despite their somewhat alarming appearance, they're usually harmless. They're most commonly seen in older adults, though they can also make an appearance on younger skin. While cherry angiomas generally don't cause problems, it's important to take note of any changes. So if you spot a red mole on your skin, don't panic, but do keep an eye on it. So, you might be wondering who gets these cherry angiomas? Now, cherry angiomas are quite democratic in their occurrence. They are most commonly spotted on older adults, with the likelihood of their appearance increasing with age. However, they do not discriminate against the young and can pop up on younger individuals as well. These red moles, as they are sometimes called, are common skin growths that are typically benign. They tend to show up in the most unexpected places, flaunting a reddish or purplish hue. Their appearance can be credited to clusters of small blood vessels that form under the skin. While these skin growths are usually harmless, they can sometimes cause concern, especially if they start bleeding or change in appearance. It's always a good idea to keep an eye on them and consult a doctor if you notice any changes. Remember, cherry angiomas are not exclusive to any age group. They can appear on anyone at any time. Age is no barrier for these skin growths. They can appear on anyone. Are there times when these red moles should cause concern? This is a question that might be on your mind. Let's delve into it. Even though cherry angiomas are typically harmless skin growths, there are instances when they should not be taken lightly. Imagine a cherry angioma as a calm lake, consistent in its appearance. However, if the lake begins to ripple unexpectedly, it's a sign that something's up. The same goes for these red moles. Any changes in their appearance could be a red flag. This includes changes in size, color, shape, or if they start to bleed without being scratched or injured. Why should you worry about these changes? Well, these alterations could possibly be an indication of skin cancer. Yes, you heard it right, skin cancer. Although it's a rare occurrence, it's better to be safe than sorry. Now you might be thinking, how can I be sure? The answer is simple. If you notice any changes in your cherry angiomas, make an appointment with your doctor. It's essential to get a professional opinion. The doctor might conduct a biopsy, a simple procedure where a small sample of the skin is taken for examination under a microscope. This will help to diagnose or rule out conditions like skin cancer. Remember, it's your body and no one knows it better than you. Keeping an eye on any changes, no matter how minute they might seem, is crucial. Regular self-examinations of your skin can help you become familiar with the normal state of your cherry angiomas, making it easier to spot any changes. In conclusion, while cherry angiomas are usually benign, they require your attention. So don't ignore any transformations they might undergo. Remember, any changes in your cherry angiomas warrant a visit to your healthcare provider. If these cherry angiomas are harmless, why might someone choose to remove them? You may ask. Well, there are a few reasons one might consider. Foremost, cosmetic reasons play a significant role. Some people simply prefer their skin without these red or purplish spots. Additionally, if a cherry angioma begins to bleed, perhaps due to an accidental scrape or constant friction from clothing, removal may be considered to prevent further bleeding. So, how are these angiomas removed? There are 4 common procedures, each with its own merits. Let's delve into each one. Firstly, we have electrocauterization. This involves using an electric current to burn off the angioma, effectively stopping blood flow to the growth. It's a quick and relatively painless procedure, but it may require multiple sessions for larger angiomas. Next, we have the shave biopsy. This method involves shaving off the angioma from the skin's surface. It's a straightforward procedure and it's often used when the angioma is raised above the skin's surface. Then there's cryosurgery. This method uses extreme cold, usually from liquid nitrogen, to freeze off the angioma. It's particularly effective for smaller angiomas, but again, larger ones may require multiple sessions. Lastly, we have laser therapy. This method uses a concentrated beam of light to break down the angioma. This procedure is often chosen for its precision and for causing minimal damage to surrounding skin. Each of these procedures has its pros and cons, and the choice often depends on the size, location, and number of angiomas, as well as personal preference. It's worth noting that these removal procedures are usually quick, and the recovery time is typically short. However, it's paramount to have a discussion with your healthcare provider to determine the best course of action for your individual situation. While removal is not necessary, it is an available option for those who desire it. It's all about personal comfort and preference. After all, your skin is the most visible part of you, and feeling comfortable in it is key to confidence and self-esteem. What are the potential risks of removing these skin growths, you might wonder? Well, while cherry angiomas themselves are typically benign and harmless, the removal process does carry some minor risks. Let's delve into those. Firstly, scarring is a rarity, but it's not entirely impossible. After a procedure such as electrocauterization, shave biopsy, cryosurgery, or laser therapy, some individuals might notice minor scarring. However, it's important to note that these instances are few and far between. Another risk to be aware of, particularly for those with darker skin tones, is pigmentation changes. These changes could occur post-procedure, altering the natural color of your skin in the affected area. Again, such instances are not the norm, but it's worth keeping in mind if you're considering removal. Now, let's move on to a different but related topic: similar skin growths. Cherry angiomas are just one type of skin growth. There are several others that resemble them in appearance, leading to potential confusion. Hemangiomas, for instance, are benign tumors made up of blood vessels. They might appear at birth or develop in the first or second week of life. Then we have the spider nevus, a type of angioma that looks like a spider web under the skin. Strawberry nevus is another similar growth, often present at birth or appearing in the first or second week of life. They usually disappear by the age of 9. Pyogenic granulomas are small, raised, red bumps on the skin that usually form after an injury. They tend to bleed but are typically harmless. Last but not least, we have telangiectasia, a condition in which tiny blood vessels cause thread-like red lines or patterns on the skin. These patterns might form gradually and often look like a web. While removal is generally safe, it's crucial to be aware of potential risks and other similar skin growths. Knowledge is power after all, and the more you know about these conditions, the better equipped you'll be to make informed decisions about your health. So, what's the main takeaway about cherry angiomas? Well, they are common skin growths, often presenting as red or purple spots. Typically they're benign, which means they're not cancerous and don't pose a direct threat to your health. However, this doesn't mean they should be ignored. Changes in appearance, such as size, color, or bleeding, could be a sign of something more serious, like skin cancer. It's crucial to monitor these changes and consult a healthcare professional if you notice any. Removal of cherry angiomas is an option, especially if they cause discomfort or are a cosmetic concern. Procedures like electrocauterization, shave biopsy, cryosurgery, or laser therapy can be employed. However, it's essential to remember that while these treatments are generally safe, there are potential side effects like scarring or changes in pigmentation, particularly in those with darker skin tones. In essence, cherry angiomas serve as a reminder of the importance of regular skin checkups. They underscore the fact that even seemingly harmless skin changes can sometimes indicate underlying health issues. Regular skin checkups are key because when it comes to your health, you can never be too careful.